Hello, this is Dr. Vasundara Cheepurupalli, consultant gynecologist, laparoscopic and robotic surgeon from 𝗤𝗵𝘁 Hospital, Secunderabad. What is gestational diabetes? The patient may not be diabetic prior to the pregnancy. So, the patient will be landing up with high sugar levels or high glucose levels in pregnancy. That can be diagnosed at any trimester, either it could be first trimester, second trimester and third trimester. So, usually the symptoms will be frequent hunger or frequent loose outs. That means frequent will have patient may have sudden blinding episodes, any kind of excessive hungers and all these, and increased urination. And in routine blood tests too, we can find out that the patient is landing into gestational diabetes. And many a times, as this is called gestational diabetes, the patient will have normal sugar levels post pregnancy. And these patients are more prone for landing into proper diabetic, type 2 diabetes seen later. So this is a prior indication that the patient has a chance of landing into diabetes. So what is the importance of gestational diabetes in pregnancy? So what happens in gestational diabetes? Sugar levels will be there in mother, and less amount all these will be diverted to the baby, and excessive hormonal changes to happen in baby, and the baby will be landing up with the macrosomy. In baby will be having insulin fluctuation, a mother will be having insulin fluctuations, and as a result of protection, the baby tries to accumulate more and more amount of fats onto its parts. So what happens, ultimately we think that the baby is chubby and the baby is almost 4 kg, 4.5 kg, and the baby is becoming, the baby is too good. So but that is not actually the truth. The baby won't be too healthy here. The baby appears chubby, but the baby is completely diabetic too. So the baby, chances of landing of baby into hypoglycemia immediately post delivery, and these hypoglycemic related complications are very high. This excessive accumulation of fats onto the shoulders or onto the baby's tummy or other parts of the baby will cause birth problems. That means chances of normal delivery comes down, and the chances of C-section are high. Even in C-section, delivery of baby is too difficult. So this is not to be become happy by seeing a chubby baby. Treatment here is this gestational diabetes can be managed in two ways. One is medical management, and another is just simple medical nutritional therapy. That means by changing our life habits, changing our diet habits, many a times this glucose can be controlled. And second treatment, in spite of these measures and simple tricks, if the sugar is not getting control or the glucose levels are not up to the mark, then medical therapy has to step in. Either the patient is put on the medications like oral medication. In spite of that, if the sugar levels are not coming down, the patient may need to be shifted onto the insulins. This insulin requirement also drastically falls down immediately after delivery. So that indicates that it is purely confined to the pregnancy, and post pregnancy and prior pregnancy the patient is normal many a times, and sometimes it indicates that the patient has high chance of landing into diabetes post delivery.